Welcome to our Line Opinion panel this week, and thank you for making the time to be here with us. First, we're happy to have Kathy McGill back with us. Kathy is the founder and director of the New Mexico Black Leadership Council. We're also welcoming back our good friend Tom Garrity from the Garrity Group Public Relations. And it's great to see TJ Trout at the virtual table, host of the Afternoon Drive show on KKOB. Thank you all for joining us this week. Now, shortly after the end of the legislative session, Governor Michelle Lujan Grisham made an abrupt announcement ending the New Mexico's indoor mask mandate. It came a week after State Health Director David Scrase told the public he thought the mandate was still necessary. Now, Dr. Scrase addressed the media on Wednesday for the first time since the mandate was scrapped. He says he consulted with the governor and that the data shows this was a prudent move. Some have questioned the timing of this, speculating there could be some politics here from the governor. How do you see this motivation here, TJ Trout? Let's start with you. What's behind the move to end the mask mandate?
Well, I'm not a doctor, as you know, just so you know that. But
we all breathed a sigh of relief when you said that.
I had a conversation on the air with Barry Ramo about this a couple days ago, and about COVID in general. He thinks it's too soon, but I don't. And here's why. I mean, looking at the COVID numbers and the infection rate dropping and the hospitalizations dropping, I imagine the state saw this coming. And you know, I'm not usually like this, but I'm actually kind of hopeful on this, you know, barring any new horrible variant coming our way, although there was a little, not so good news about the new BA2 variant that just hit the news today. But barring any, if it's not horrible, it would seem to me that the country in New Mexico might actually be seeing our numbers shrink to the point. Maybe we're getting to the point where it's not a crisis anymore. I'm believing that the Dr. Scrase and the governor are seeing data that is coming in that might actually predict what we're seeing right now. I mean, it's not a responsibility not to protect those who are most vulnerable, because we really need to move and shift onto doing that. Our seniors and our people who are immunocompromised need to be protected. Now we got to concentrate on those people and make sure we keep them safe. But if you look at the stats, Gene, most people who die from this still are unvaccinated, granted. But also, if you look a little deeper into the stats, most people who are dying from this are elderly and immunocompromised.
Hey, Kathy, TJ mentioned Dr. Scrase pointing out several pieces of data during his presentation this week showing cases dropping, hospitalizations, deaths, all dropping at a significant rate. Not a little bit, significant. So for those who think this happened too early, weren't these positive changes the priority from the state? I mean, it seems pretty consistent, no?
Well, I think that it sort of just got all put together in this kind of mumbo jumbo, and the public's like, wait a minute, you just said one thing. Now you're saying something else. Should we have believed you before, or should we believe you now? So it becomes an issue with whether or not the citizenry trust what the information that's coming out of the government. You know, we believe that, it's facts-based, that masks do work. And so, I don't think that that's really in question based on the science, but what happens is that people just don't know whether or not they can trust what comes out of those offices, because they believe that it's tainted, by politics and the culture wars that we've been experiencing related to these mask mandates. So I think a lot of people are just saying, I'm just going to do what feels right for me. And I'm not sure if we've lost an opportunity to develop trust for what we need to do going forward, having gotten rid of this mask mandate, although we're following what the rest of the country is doing right now.
Good point there. Hey, Tom, without this mandate, it's now, let me talk about schools here. Individual school districts are now in charge of deciding whether or not to enact a masking rule in classrooms. So I got to ask, is it fair to shift this burden onto districts, or was this just an inevitability of the decision making?
Well, there's always going to be the shifting whenever this, as long as the public health orders exist, there's always going to be opportunity for additional interpretation of what the rules are. I think one of the key things that Dr. Scrase said that's relevant to the question you asked is, as he wrapped up, or as the news coverage wrapped up, Dr. Scrase says the responsibility of deciding how to keep ourselves safe has moved from the state government to the individual. And I thought that quote that was in the Albuquerque Journal was just really so telling, because all of a sudden now the focus is on the individual, and we're all kind of responsible. And so I think I see a lot of shifting of the responsibility from government, to other entities, whether it be a school district, of course, hospitals. Mask mandates are still in place.
That's right.
Elder care facilities, mask mandate is still in place, and that's good. I'm in favor of that. I don't know to kind of chime in on the thought if it's too early. Initially, the medical solution of the masking was to slow the spread of COVID, and now with the positivity rate below 10%. It seems as if that has worked, so it's time to relook at it because the impact from the mask mandate has impacted so many different organizations and individuals, both for the good as well as for the bad.
Yeah, I saw some recent numbers on what's happened to the restaurant industry and continues to. It's really just ugly. Hey, TJ, one quick last point on the school thing. When you think about it, there's been a lot of other states that have done this mask mandate kick down to the schools. And what's resulted is the schools have become a flashpoint for protesting, even the administration buildings. Do we want that? Do we want the protests to now be concentrated on the doorsteps of our schools instead?
Well, I think I don't have kids, so I can't personally talk to how I would feel if I had kids in the schools. So I understand, though, that parents are very concerned, but if parents are concerned, they need to be concerned less about the politics and more about the science and more about what's real and what's not real. And I want to talk something about what Catherine just said about the trust, the public trust. And obviously, we're going through a whole bunch of stuff now related to public trust, not just in science, but just in politics. But I think people need to realize, I don't know if the state was good at getting this message out. Science naturally changes. Science changes with acquired knowledge. Science changes with knowledge. Science changes with experience. That's the way it works. That's the way it's always worked. And people need to understand that. And if people don't understand that, well, maybe people should try to educate themselves a little better so they do understand it. And maybe the state should take a look at this and say, well, maybe we're not getting the message out the best way possible.
Kathy, it's hard though. I mean, I've had people confuse Dr. Fauci working for the state and confuse Dr. Scrace working for the federal government. I mean, they just confuse who's getting messages from where and what. So I'm just curious your opinion about what TJ just mentioned. If we have to go back to a mask mandate at some point, does the governor have the clout to be able to say, hey guys, we're going to go back on a mask regime here?
She has positional authority to do that, and they've left the door open to say that if we need to go back, we will. And I think that's what people need to understand, that they can issue another, public health order saying that, well, we're going to do it again. Whether or not that's going to happen for a lot of reasons remains to be seen.
Right.
But, it is, I totally wholeheartedly agree with TJ that it's about the citizenry educating yourself, like get the facts is what I'll just say about everything and every issue. Get the facts.
That's a hard one. Hey, Tom, real quick, the Navajo Nation keeping its mask mandate despite the governor's announcement. I'm curious if the state should have consulted with Native tribes and other groups before making this decision. Meaning could this lack of uniformity cause some problems out there?
Yes, it will cause confusion, but the Navajo Nation has its audience, and the Navajo Nation knows how best to communicate, with its residents. So I don't think that that there will be that much confusion. To the points that have briefly been made about trust of government versus trust of doctors and physicians. What we have seen both nationally in our own surveys over the last 10 years is that doctors and physicians are seen as much more trusted than government officials who have been on a steady decline for the last 10 years. So, for government to come out and say, trust us, that automatically meets against a wall of disbelief. So, there is a lot of work that government can do to build trust and transparency, but it's not something that's done overnight.
Hey, TJ, we're under about a minute and a half here. Real quick, Dr. Scrace made the point, and Kathy, I want you to get your thought on this too, to respect the decisions of others, whether or not they're masked or not, if you see someone doing the opposite, to just be respectful. Are we in that place now, TJ? Can we do that now and just be respectful to people's choices?
Your guess is as good as mine on
there you
that
go.
one. I mean, obviously, we don't want to see fist fights break out in Smiths. It's bad enough what people do to each other on airplanes these days. I mean, yes, just have some common courtesy. Respect each other. Don't be a jerk. How's that? Are those words to live by?
There you go.
Just be polite.
4 simple
above
words.
all.
That's right. Kathy, your thought on that? The idea of respect in this world.
You know, find out what it means to me. I mean, just understand that your rights end at the tip of my nose. So, you know, people need to do what's best for them, I guess, at that point. And we hope that we're thinking about what other people need as we're walking through this society where, you know, our fates are inextricably bound.
Good point there. Hey, thank you all for that discussion. We'll bring the panel back in just a little over 5 minutes. Talk about breaking news on PNM's plan to avoid blackouts this summer.